just get started in about 1 more minute. Wow, someone from the Bahamas. We love that you're listening in. Welcome, Marcia. In Miami Gardens, first time. Great. Thank you for joining us tonight. All right. Great. Well, I think we're going to go ahead and jump right in and get started. Again, thank you so much. I want to thank UHealth Jackson Children's Care for providing these amazing webinars that we've been doing consistently all summer now, summer to school. So here we are at school. We didn't think this moment was coming. We knew eventually, but it felt way down the road. And now here we are staring at the first day of virtual school for many coming up next week. I know many have started this week and last at private schools and daycares and preschools. So we are in the thick of it. And COVID is still a very real thing for us. It is something our community is still dealing with and working through. So lots of information tonight that I believe is going to be very helpful for you as families, as individuals, as you prepare for this time. So without further ado, I'm so excited tonight to be your host. My name is Cierra Bragan. I'm the owner and founder of Miami Mom Collective. So we are Miami's premier parenting resource. We have all sorts of resources and content for you on our website, as well as events. Typically, we like to do events in person, but we're doing virtual events right now to serve our families, as well as just a meaningful community for local moms. So if we can be a resource to you, you can find us on Instagram, Facebook, all the places, website, Miami Mom Collective. So it is a joy and an honor to be your host. And what's so fun is tonight, our guests actually were our very first guests. So episode 1, we had Dr. Ofir and Dr. Chatani, and we're so excited to have you back again. So thank you for being with us. I do want to take a minute and introduce them and share just their expertise so that you know you are truly hearing from experts tonight. So Dr. Ofir is actually Associate Professor of Pediatrics and the Director of the Pediatric Comprehensive Care Clinic at the Holtz Children's Hospital at UHealth Jackson Children's Care. So one thing you need to know is that the Holtz Children's Hospital, you may not know this, and Jackson North are actually open 24/7, never closed, every day, all the time. And they're all staffed with board certified pediatric emergency medicine specialists. So if you need at any moment to take your child or yourself, or you're worried about, goodness, do we have COVID or is there an issue? The emergency rooms are 24 hours. And actually the one at Holtz is 24-hour children only. So that's a great place to go if you have something, a particular need for your child and you don't want to be susceptible to everything else that could be out there in a general emergency room. So also all the doctors and the nurses at Holtz are certified in pediatric advanced life support. So all these special certifications that really are helpful for your family if, heaven forbid, you ever had a need. So Dr. Ofir, we're just so glad that you're here. She also teaches both the University of Miami students as well as Jackson Health physicians in training. So at all levels, she is, you know, they always say like you can know something, but you can teach it. And so she is like, knows it so well that now she is teaching others, which is amazing, particularly in the area of outpatient primary care. She's lectured on many subjects, immunizations, newborn visits. All of her expertise really centers around the medical home model, which I'd love for her to share maybe a little bit more about that for people who don't know. But she's been practicing for more than 15 years and really specializes with families whose children may have, you know, more complex medical needs, including cerebral palsy, Down syndrome, sickle cell, leukemia, as well as transplant patients. So Dr. Ofir, we're super excited about the expertise that you bring tonight. So would you just real quickly, can you talk a little bit about the medical home model that for people who may not understand?
Of course. Good evening. Thank you for having us again. So the medical home is actually not a physical place. It is a way to practice medicine. And it is, I call it co-piloting. where the physician, along with the family, kind of navigates through the healthcare system, which is quite complex nowadays, making decision and helping them out with coordination, trying to communicate with subspecialty, making quite significant decision throughout the path of the child as they're growing up, making sure that the quality of life is at its maximum, and just making sure that we're there for them, that we are accessible at all times, and making their medical home and medical decision as convenient as possible.
I love that. That's so great. I think that's something we can easily gloss over and go, I don't know what that means. So it's great to know more about it. We appreciate it. We're so glad that you're with us again. We had a wonderful time with you on episode 1. So excited to learn from you again tonight. And then also I want to take a minute to introduce you to Dr. Brandon Chatani, who is an assistant professor of the Department of Pediatrics, particularly in the Division of Pediatric Infectious Diseases, which is super relevant right now. We all are like, all of our flags are up. I feel like more than ever, those of you who work with children, of course, but in infectious diseases, we're like, tell us all the things. So we have lots of questions for you tonight, but Dr. Chatani serves as the principal investigator on grant-sponsored research at the Transplant Institute. So he's been published, he's done research on viral and bacterial infections that occur in pediatric organ transplant. So I just can't imagine all that you must know about that. That's so interesting. And in addition to that, he conducts regular rounds for the antibiotic stewardship program at the Holtz Children's Hospital, working with the infectious disease clinical pharmacy. And not only that, but I just love that you're so involved in the community, sits as a chair as well as a board of directors of many organizations that are helping some of the city's most vulnerable youth. So you're not just doing this as your job, but I love that outside of your work, you're just giving in ways that is enhancing our community. So thank you for that. And we're just so glad you're here tonight.
Thank you. Glad to be here.
Well, let's jump in because I'm like itching. I have so many questions. And I want to tell you, if you're listening in at any time, use that Q&A box. It's best if you put the questions in the Q&A box so we see them, and we will do our very best to get to them. So at any time, if you want some clarification, throw them in there and we will we'll get to those. But let's just kick things off. Okay, back to school. Let's talk about routine, because we've had a 6-month summer. So now what? How do we get our kids back in a routine?
So I think that the biggest thing to tackle right now for the parents is the bedtime routine. I think that with this whole pandemic and the confinement and all of that, the bedtime routine has changed drastically. I have actually several of my patients who are telling me that they're going to bed at 2 and 4 o'clock in the morning. They're waking up at 2 o'clock in the afternoon. So that's not going to work when we're going back to school. So what I would recommend probably for the parents is to start getting them back into the proper routine, and probably in increments. So let's say if they are going to sleep at 2 o'clock in the morning, starting to get them to bedtime, let's say an hour before at 1 o'clock in the morning, and waking them up an hour earlier than what they're doing right now. So let's say at 1 o'clock in the afternoon. And then a few days down the line, let's go ahead and do midnight, and then waking them up at noon, and so on and so forth, until they end up with the right bedtime for their age and the right amount of hours of sleep. I think that what they're doing at bedtime is also very important, because, electronic, definitely not a good idea at bedtime. You want to choose a very quiet activity, perhaps reading. You want them perhaps to do their shower, their bath. You might want to do the dinner time a little bit earlier with not a very heavy meal. You want to go ahead and make sure that their bedroom it does not have a lot of light. Make sure that the temperature is also comfortable. But first and foremost, bedtime routine, very, very important, I think, right now for the parents to tackle.
That's good. Specifically, can you hone in on like what's a good, like average amount of sleep hours for a kid, maybe like 4-year-old, 6-year-old? That was one of the questions we received.
So that actually at that time is still a good 10 to 12 hours, and probably depending on if they're still able to do their nap. So the nap will be a 2 hours, and then their sleeping at that time would be 10 hours.
That's great. Isn't it funny? I feel like I wrestle with my children to sleep, and I catch myself going, what I would give for someone to tell me to go to bed or take a nap. It's just the tables turn, you know? Too funny. Okay, what about virtual schooling? Has started for a lot of people, is starting, obviously Miami-Dade on the 31st, I believe is the day. Children are going to be sitting in front of the computer for hours. Like, how can we prevent computer fatigue? Is there anything we should be concerned about with their eyesight, staring at a screen all day?
Yeah, I think definitely, and it's not just the children, but anybody who's going to be watching a screen or reading on a screen for many hours a day, there's going to be some health issues and some complaints. So whether headache or dry eyes or neck pain, shoulder pain, there's actually something called the computer vision syndrome, which has all of those complaints and also some blurry vision. Because the problem is when we are watching a screen, the letters, for example, that we are reading are not as sharp as when we're reading a paper or a book, if you will. And then also the contrast between the letters and the background is not as sharp as on a paper. And then there's always a glare that we have on the screen. So all of that combined makes our eyes strain a lot more and work a lot harder than if we were reading on a book or on a paper. So definitely, if one of our children is having any of those symptoms that I mentioned, the headache, the neck pain, or the blurry vision, the first thing to do, of course, is to schedule an appointment with an eye doctor, get a complete exam. But better yet, we might want to think about preventing it. So there's something called triple 20 rule. So what we can do is every 20 minutes, we have our child not look at a screen for 20 seconds and have them stare at an object that's 20 feet away. So every
Wow.
20 minutes
Okay.
for 20 seconds, staring at an object that's 20 feet away. Because prevention is always better than treatment.
Right. Oh, that's great. And that's something I had no idea about. And probably it's a good practice for adults as well, I would think.
Absolutely.
How many hours a day are we staring at the screen? Oh, that's really good. That's really good. Okay, let's talk about keeping our kids physically active during this virtual school situation. Any tips for that?
Well, I really think that in order to make physical activity successful, you have to engage the whole family or the siblings, because especially for teenager, they may perceive this as just another chore. So in order to really make it successful, just engage the whole family and make it a family event. So let's go for a walk. Let's go ahead and do a bike ride. Let's just go ahead and play ball all together. I think that this will be a lot more successful and be perceived more positively rather than just saying, okay, you know, just go out.
Run.
Right.
Yeah. That's good. That's good. That's a good challenge. And a reminder that we need that too. It's so easy.
The adults need it in the family anyway as well.
Yeah. Oh, that's good. What about with the little ones? Like, well, if they're having to do, I know I've heard, you know, as young as preschool, they're doing some virtual components. I saw a funny, I think, little meme or something on Facebook the other day that said, it was like the mom said, or the kid said, I don't like this show. And then the mom said, this is virtual school, honey. You know, it's like they're even the little ones they're sitting in front of the computer. So do you have any advice for the ones that do struggle to focus? Like any tips for helping them focus in?
Well, I think, you know, if we want to focus during the day, it starts at night. So we talked about bedtime routine, right? So I always tell my patients, it's like when you want to get ready for a ride, right? You want to put the right gas in your car and you want to put enough gas. So let's just go ahead and not only have a good amount of sleep, but also a good breakfast. So we want to go ahead and have healthy protein, some good fiber, some nuts, yogurt, berries, for example. That's a good healthy breakfast, which will give a nice amount of boost for our brain, because our brain needs nourishment to be able to have some good energy to get going. So also what I usually recommend is the area that the child is going to be able to do their virtual learning has to be a quiet area that is not going to be in the middle of noises. noises and disturbances because they're going to be easily distracted. The other thing is make sure to provide them with some structure, but also some breaks. And if possible, outdoor breaks, because it's very difficult to be learning virtually for hours on end, whether they're very young, but even for the teenagers. And then try to help them stay organized. So not so much the little ones, but maybe the elementary school or the high school. You might want to go ahead and get a calendar and then maybe color coded and remind them of the assignment with colors along the classes. So all of that together to be able to kind of stay focused, good amount of sleep, good food, and just kind of get them a good structure and good breaks.
Good. That's great reminders. Talk to us about those parents who, have decided maybe to send their child to daycare or preschool or private school where things are happening in person. What kind of questions should we as parents be asking, of the protocols or procedures that they have in place for safety and security during COVID-19?
For sure. I mean, we have to think of the high contact situations. So you're asking the school, what are you doing about classroom first and foremost? Or how are they separated? Who's wearing a mask and who's not? Is it a requirement or is it voluntary? After that, you have to think of lunch, which is a high contact area as well. And then sports and play, what are they permitting the children to do and in what type of environment? Lastly, I would say bathroom is something that often, bathroom time gets left off the list of what gets asked about. If children are going by themselves or if it's like a group time when everybody gets to go to the bathroom, you want to make sure that you limit as many of the exposures as possible. Certainly with good hand washing breaks are all going to be necessary in this time when at any moment exposure could occur.
That's good. The bathroom thing, I forget to ask about that. Yeah, that's good. Dr. Ofir, are we going to add something?
I was just going to say, I think this is a really difficult time for parents because they have to do so much homework. I remember we talked about this during our first webinar, but there's so many things that I think that, they probably want to try to find out from the school. Besides all of these things that Dr. Chatani mentioned, let's try to find out also, if the school is going to have some kind of screening, for whether the teacher or the parents or the child, I should say. So maybe they're going to have an online questionnaire, to be able to find out whether, the person is sick or not. The hallway traffic, for example, to try to mitigate that, are they going to have a one direction traffic? And then also, what is going to be the role of the nurse, over there? So there's what is going to be the protocol if there's going to be a COVID positive exposure, and then the protocol, when is that person coming back? School. So I think it is really a huge challenge, and but they have to just open the discussion because it is really at the level of their school that they have to be able to figure out whether their own school has that plan.
Right. That's good. Yeah. That's the first thing I want to know is, okay, what happens if it enters the school? How are we handling that? So great questions. I want to deviate just a little bit. And Dr. Ofir, Dr. Chatani, I know, we're not going to get into particular medical advising of people, but we did receive one question. And I know you guys are seeing COVID patients, but if this mom says her daughter did not have any symptoms, but she was in contact with someone who tested positive. And through contact tracing, she was told to quarantine and take a test. So they did that today. Now, like suddenly she's saying she feels like she can't breathe, but she's like, maybe she's just nervous. Should they take her to the hospital if she doesn't have a fever? Her only symptom is shortness of breath. I don't know if you can speak to that because it's particular, but maybe in general you say something where we can pass. I know we can't speak particularly, but anything you would encourage this mom with?
Certainly anytime that a parent is concerned about their child and they think that their health is at risk, the emergency room is there to make sure that your child is safe.
Yeah.
That's the best advice I could give.
That's
Yeah, I
good.
totally agree. I mean, especially when you have respiratory symptoms, I completely agree with Dr. Chatani. I think that the parents know their child best, you know, so if there's a concern, absolutely.
Yeah. And I think we spoke about this. I don't know if it was in our first webinar together or another one later, but that there's never anything to be nervous or ashamed about if you go and everything's fine. Like thank goodness you went and everything was fine, then you didn't go and something was wrong. So Holt's Children's Hospital 24/7, they're open. So put her in the car now or after the webinar, go check it out. But thank you. We'll again, if anyone has questions, drop them in the Q&A. You know, we will have to steer clear of any particular advice. Yes, doctor.
And I just want to add that, you know, our ER really is going above and beyond to make sure that the precautions are taken. So I think that some parents are a little bit fearful about taking their children. But I mean, I have been sending my patients there, and they are outstanding as far as safety precautions and infectious precautions over there. So I actually have taken family members over there. So they are outstanding, really.
That's great. It's such a reminder too that the two of you are in this world every day, steeped in it, and you've been safe and fine. Thank the Lord. But so yeah, that's a good reminder that it doesn't have to be a scary thing. So it's a great resource there and available. Wonderful. Okay. What about, let's talk about the benefits. So some parents may still be weighing this. Okay, we're starting virtually, but maybe we're going to go, you know, physical schooling soon. What are the benefits of physical schooling, and how can people kind of weigh the risks and benefits of sending their children?
So both the American Academy of Pediatrics and the Florida chapter have been very vocal about the benefits of in-class learning, because we know from studies that children learn better around other children. But it's not just the educational component. Schools bring meals to children, especially the underprivileged children. It also gives therapy, so maybe speech therapy or behavioral therapy to some of the children. It can actually also give perhaps psychological counseling also to some of them. So it brings a whole array of other services besides the educational component. However, both entities have been very clear on the fact that those benefits must outweigh the risks. Risk to the children, the risk to the families, and to the teachers and the school staff. Unfortunately, Florida in the last few weeks have seen the numbers increased, and especially the COVID positivity rates has increased up to at 1.12%, and it is way higher than what the Florida chapter is recommending for the reopening of school, which is less than 5% or even ideally 3%.
More than double. I had no idea.
Exactly. So certainly the in-class reopening of school had to be reconsidered.
Wow, that's good. Yeah, it's so good to hear from you, because there's often information that maybe we don't know that goes into all of these decisions. And, you know, as a parent, we can kind of have maybe one track view of the things. And so it's great to hear from you both on this topic. Any tips, I guess, as we prepare to transition, if that time comes, of sending the children back to physical schooling? Anything we could even be doing now, not even knowing maybe when that day is, to just be prepping them?
I'm very pro practicing, preparing practicing. So I think that certainly parents can go ahead and practice kind of a routine with their kids. And first and foremost, they want to go ahead and have the discussion about COVID at the age level appropriate for their children, explain to them again what COVID is all about, talking about what we call now the 3 W's. So wearing the mask, washing their hands frequently, and then watching their distance. So making sure that they remember all those 3 W's when they're going out of the house, but also practicing some routine in the morning. The parents might want to go ahead and preparing their school bag, including a small plastic bag with their name on it, so that when the child has to remove their mask, for example, for lunch, they can go ahead and put it securely in a bag with their name in it. I think I would recommend certainly to have a backup mask in the bag just in case. If they could maybe perhaps put a little individual sanitizer bottle in the bag for their own individual use. if the school allows, maybe a small water bottle, because when you breathe through a mask for a certain number of hours, it really dries your mouth and dries your throat. So that might be a good idea. And then perhaps practice the after school routine. When they get home, it's important to wash their hands very thoroughly. And maybe right after that, take a bath or a shower, and then remove the clothes, and then wash the clothes and the mask daily as well.
Daily, yes.
Right.
Oh,
And
that's
all
such
of
a
these
good
practices aren't just, all of these practices aren't just for COVID.
Yeah.
They also will help prevent the flu season right around the corner
Yep.
with the
That was
spread
my
of
next
flu.
question. That's so good. When she said www, I'm like, this is good for life. Like wash your
Your life.
hands, keep your distance.
Absolutely.
Yeah, so we did receive a question that with flu season coming right around and COVID, the symptoms are similar. What kind of things do we hope maybe the schools would be doing or parents could be doing, in addition to like a flu vaccine or separate from that? But obviously www is a great one. So anything else you'd add?
Well, I mean, definitely with the current practices, the hope is that the flu season this year will be less, but we still have to do as much as we can to reduce it, considering that the symptoms overlap and it's going to be very hard to differentiate other than getting tested. And we all know how testing goes right now, and getting access to testing sometimes can be difficult. Having the turnaround time can sometimes worry parents because it takes days before you get the result. So we got to make sure we stay safe and stay healthy by doing those 3 W's, and practice them, practice them, practice them, give rewards, make it fun, make it something that's just part of their life. And even after COVID, it should be part of their life.
Yes, these are good habits to do now while they're at home, and you kind of have that control to help them happening every day, and then it just creates a natural habit. So when they go back, you mentioned that hopefully flu season will be down this year. Do you think with everyone wearing masks and practicing these things that some of the other exposure to other viruses will go down, like maybe hand, foot, and mouth or flu, or do you think some of that would?
There is some literature currently coming out from other countries that are a little bit ahead of us in terms of the curve and the wave that they have already done.
Okay.
Flu definitely was less in some of those countries that really implemented all of the masks, all of the hand washing, every protocol that we've discussed so far, as compared to other places that did not necessarily. And regardless to what their COVID was at the time, they still have started with flu season back.
Okay. Yeah, that's good to know. Great. Well, hopefully my kids have stayed more well since we've been home. I'm like, well, there's a benefit to being home a lot, and so we're not at the pediatrician all the time for this or that. So hopefully, yeah, we can see some, reduced numbers and those other things as well as we're being diligent. So great things. All right, let's talk about what mask wearing with children. What are scenarios when kids should definitely wear a mask versus when it would be okay if they didn't and there was a little more leniency? Because, these young kids, it's challenging. And kids with special needs as well. It can be very challenging, sensory issues. So when is it absolutely necessary and when is it okay that they could have them off?
Right. If you're entering in a scenario where you're less than 6 feet from another person, that a mask is absolutely necessary. It's just a situation where you're at the highest risk. So, parents have to go shopping for groceries, and you go out and you're in the aisle and there are people not recognizing the direction they should be going. And it's just the safest practice to be wearing a mask at those times. Now, other times where, you're able to maintain the 6 feet, then you have those situations where children of certain ages or difficulties with wearing a mask, it can be acceptable and safe to not wear the mask. I will give the alternative, though. There are studies that show that any barrier is better than none. And so that includes even the face shield. And a lot of manufacturers have been releasing products that are very comfortable and stylish for children to wear a face shield that just covers their face, but doesn't necessarily obstruct their airway and isn't as uncomfortable as wearing a tight-fitting mask.
Right. No, I've seen the little, animal ears and all that. And I kind of wondered, I'm like, is that just silly? But that's good to know. Something is better than nothing.
Yeah, it definitely, and it's pretty effective. Like, it's pretty good.
I think that might be helpful too for children that may have sensory issues. Maybe it's a good kind of transitional thing to work towards a mask or something. That's great. What about activities as kids are starting back school? What activities would you say avoid band practice or no football, or are there any certain things you would say about that?
Yeah, football and the contact sports are going to be a no-go for right now, especially while our community spread is so high.
Right.
If there's no contact involved, then you're probably going to be in a good place to be able to participate in. And it all just depends on how much contact and sharing of things there are. So, I mean, there's some swimming sports that are fine, that you stay in your lane and you're going down the lane and don't come in contact with other people. So you just have to think through what the activity is.
That's great. That's great. Everybody sign your kid up for, swim team this year. We'll have an influx of swimmers in this generation. What about band? I mean, it's not contact, so you think that's probably a safe one?
Band is difficult because it really depends on what kind of instruments in the area that you're in. If you're there blowing strongly into an instrument, you're just kind of disseminating it. And we learned from tuberculosis, from Mycobacterium tuberculosis, that there were opera singers that would go in front of a crowd and sing in their highest voice, and the entire front row would have tuberculosis by the end of it.
Wow.
Yeah, so we don't want to be spreading disease at the same time with playing our instruments.
Right.
So we just have to be mindful.
That's good. That's good. One mom wants to know if there's any research on the flute. Can her child continue with the flute, you think?
I mean, it depends where she's playing. If she's playing the flute at home, like there's no risk.
That's right.
While she's home, that's fine. But I would say, like, if you're in a room with other flute players as part of a choir, that might be a higher risk situation.
Right. Things like dance. Oh, I'm sorry. I didn't mean to interrupt you, Dr. Ofir.
No, I'm sorry. No, I was going to say, I guess any instrument or activity that makes you breathe harder. So again, the sports, it's an exertion, makes you breathe harder. The flute or the trombone or any of those wind instruments, it makes you breathe harder. And so that's how those aerosolized particles are coming out more. And that's where the risk is higher. If you're doing the drum or if you're doing the piano, I guess that's a little bit better. And you can you can wear your mask at the same time anyway. But any of those wind instruments, I think, is probably carrying a higher risk.
That's good. That's good. I wish we had time to weigh every sport and activity that we have questions about, but some are saying, what about dance? What about soccer? Things can become contact, right? But things can also be distance. So I've seen dance classes where they're spreading everybody out. So
right. So it's that same set of questions that we talked about before that you're asking the dance studio. I asked my son, I have 2 children. My son does Taekwondo, and I assessed what they were doing in class, and I determined that it wasn't safe for him to return to class, but they had offered a virtual. So now he's in our living room kicking and punching. So it's fine. He still gets his activity. It's a break from his schoolwork, and he still gets to be involved.
That's great. There's so many opportunities out there for virtual activities. Wonderful. Well, we're going to transition subjects here. Before we do, we were speaking earlier about encouraging that mom, whether or not she needs to visit the ER. We actually have a previous webinar on this of when to choose ER versus urgent care. But correct me if I'm wrong. If I'm not mistaken, urgent care, there's doctors there, so they can see almost, address most things. Obviously, if you're having serious breathing issues right there, you should head to the ER, correct?
Right. Respiratory issues are taken very seriously. So that respiratory meaning breathing. So we take breathing very seriously because you need it to live. ER is involved if if there's an issue with that.
Great. All right, let's talk a little bit more about activities because this is a hot topic. And just playing with friends, that's kind of an activity we took for granted for so many months. And now children are going back to school or even virtually, they're connecting again with friends. If our kids want to have a play date, like, is it safe? Like, could it happen at our home or outdoors? Like, what would you suggest in that situation?
I definitely recommend outdoors more than being confined into a particular space. And
Okay.
it's really going to be that conversation between parents about what their practices have been, if anybody has been positive, if anybody has been sick, and being aware, trying to keep those the kids with an activity where they're not on top of each other or sharing items necessarily, but doing a stroll through a park or doing a nature walk, like those things are very easy. They can still be around each other and they can still talk to each other, even being wearing a mask, and still have that social interaction. It's definitely valuable to still consider.
For sure. These are things our children need too, or those, social, emotional connections with their peers. So there's safe ways to do that. Talk to us about birthday parties. Like, do you think birthday party gatherings are wise, unwise right now? How many is too many to gather?
Right. The last CDC, the Center of Disease Control, was really looking at 10 being the magic number for homes. But of course, that depends on the size of your home in the area that you're having the birthday in.
Right.
You can't be in a closet with 10 people because that will cause serious spread of infection. So you have to consider the space. Having that 6 feet is what it's about. A lot of people, again, have been very creative. The drive-by birthdays where
Love
people are
those.
honking and they dress up their cars. You can be super creative and they still get a present and it's fun. Or the virtual ones where you have virtual dance parties and special guests that come on. All of those are super safe to do and alternatives that you can consider. But if you have to have that in-person birthday party, you have to figure out how to do the 6 feet apart.
Yeah, that's good. And if you think about it, when we say 10, you got to count mom, dad, brother, sister, abuela. Okay, you get to invite 4 friends. That's it.
4 friends, and not their parents.
Exactly. And they have to come alone. The 6-year-olds have to come alone. That's funny. Well, I do want to take a minute, put a plug for on MiamiMomCollective.com. We have a resource called a social distancing birthday guide, which are lists tons of companies that Brandon is talking about here that help create a drive-by safe distance scenario. So there's lots of ways to still celebrate in a safe way, but that's great. Let's talk about public venues, entertainment, the zoo, bowling, museums, bounce house venues, trampoline parks. Talk to us about the good, the bad, and the save it for laters.
Yeah, a lot of public centers have really taken up the torch in keeping their activities safe because they want people to come. I've been very motivated by seeing that the zoo has directed people to walk in a certain direction, limiting the amount of people that come through. So it's like a nature walk, right? You get to walk through, not have any contact, maintain your distance, and enjoy all of the animals and their silliness that they have. So you just have to consider the contact and how many people are in a space before you consider the activity.
Yeah, that's good. And are you going to be touching all kinds of things that other people have touched in order to have a good time, or can you just, that's good.
Exactly. Yeah, the bounce house, I would say no.
Yeah.
That's high
We'll swing
contact,
it
no
later.
control. It's just chaos embodiment. So I would not recommend for a
It's
bunch of
crazy on
children.
a good day, on a non-pandemic day. It's a risk, right?
Yeah, right. Absolutely.
I love it.
So you just have to think of what kind of contact you're going to have in the activity to determine safe or not safe.
Yeah. What about families who are feeling stir crazy and they're like, okay, we just have to get out? But obviously we talked about WWW, washing our hands, keeping our distance. Is there any other precautions that you would suggest to families, beyond what we're like trying to learn in our minds as the new normal?
Right. It's really about being creative and getting out of the mindset of being trapped at home.
Yeah.
Going outside is still safe. And if you go outside and maintain your distance from others, it's a great way. I mean, we live in the Sunshine State. It's amazing to walk outside. We should reinvigorate ourselves in wanting to go outside. But equally, taking a drive, like driving and seeing certain parts of the city maybe you haven't seen, or art that you haven't seen. It's safe inside of your car. You don't need to wear a mask inside of your car, especially if the windows are up. So there are safe activities that are out there that can be done that aren't like in front of a screen or confined to your home.
That's good. I love the mentality you said too of not having the mentality of I'm stuck at home, but like we're safe at home. So what are other ways that we can explore in a safe way? One of our previous webinars, we had the Children's Trust on, and they created a whole website, stayhome.miami, with tons of resources for kids, for families. And I love the idea just to take a drive. I'm like, just put me on, the causeways, any of them. And I feel like I took a vacation, right? People vacation in the place that we feel stuck, right? So it's a good mental shift for us. That's good. Talk about stress levels. How can we effectively, not stress levels, but like stressing the importance of social distancing. Maybe this is related to stress levels because it deals with our high schoolers, but it is stressful communicating with a high schooler on a good day, but talking to them about the importance of social distancing and COVID precautions, because, a teenager knows everything and needs no help. But any advice on that?
Well, I think we have to remember that adolescent is a stage in life where it's all about friends and social encounters and activities. And so this whole pandemic changed our adolescent social world.
Yeah,
Uh, and so a lot of parents are having a hard time understanding their teens' reactions and what to do about it. But I think that probably the key here is to be empathic. I mean, to really acknowledge their feeling, because for them, not being able to participate to a school activity, whether it is a school dance or a school trip or a sports event, is a big deal. And so they feel this loss, if you will, this feeling of loss. And so it is important to acknowledge it and not to minimize it. And we have to make sure that we also have the talk with them to explain again what COVID is, because as we know, adolescents have a hard time to grasp the idea of what is this all about?
right.
I'm feeling fine. My friends are healthy. Nothing's going to happen. What's the big deal about, getting together with my friends?
Right.
So we have to kind of clarify to them that this is not all about them. First of all, they're not in it, alone.
Right.
Everybody, including their friends, the family, everybody has to do the same thing. And that hopefully this is not forever. I mean, in order to actually end this crisis earlier, is to be able to follow the rules of social distancing and masking and washing our hands. This is how we're going to be able to counteract this virus. And then, they have a tendency to feel that they're invincible. So we have to, again, make sure that they understand. I mean, the fact of the matter is that at this point, we only have two choices. We can either follow the rules and try to really bring down the level of the COVID virus and save as many lives as we can, or we don't, and then we increase the virus level, and then unfortunately we risk more lives. These are the only two choices that we have.
Right.
So I guess the key would be really to just try to be empathic with our high schoolers, to try to offer them structure. It's important to, of course, recognize that they need breaks, that to understand that they want to be online, to socialize with their friends, and to engage the family, to try to create family events, or perhaps dinner time, to actually make it, if possible, the family time, to be able to have the talk and the discussions of maybe what went on, or if anybody is having issues with anything going on with this COVID.
Right. Oh, that's good. A good perspective. Yeah, and those two choices, it's like, and whatever we choose is going to impact how much longer we have to kind of live in this limbo situation of, yeah, that's good. Well, we're going to transition. We got like a little under 15 minutes together. So I want to transition to a few questions about vaccines. But before we do, we received a few questions I want to address from our attendees. And Erica, I know she asked a question about, I think we hit on it, but if we need further clarification, please let us know. But about other viruses, going down, hopefully we'll see a decline in flu. But, at the end of the day, choosing whether or not to send our kid virtually is just a personal choice. And we have to really weigh the options of, is the risk worth, what it could it could mean for a family. So, so hope we answered that one. Dr. Ofir, did you have something?
No, I was just going to say, and really, it is really a family decision because it really depends also where you live. You know, it depends what the rate of the COVID is in your community, and it also depends what your school is going to be doing, you know, as far as the COVID modifications are concerned. So it is definitely a family decision.
Yeah, that's good and unique for everyone. Yeah, because every situation is unique. Dr. Chatani, would love for you to speak to this one because I know that this is something you work with particularly, but is the feared, you know, MMSC or MIS-C, if I'm saying it incorrectly, is that a consequence of COVID or is it something that presents while the children are positive?
So there can be children that are positive with COVID and have MIS-C,
Okay.
but the entity in itself is a result of after having COVID. So COVID was there, you had the infection, maybe you recognized it, maybe not. And now we've just started to develop an antibody, and it really is a condition where your body is having a hyperimmune response.
Wow.
So that's the immune system being hyperactive and chaotic when it shouldn't be, and causing and basically attacking the body. Particular parts that we get concerned about with MIS-C is the heart, in that it causes coronary dilatation. It causes the arteries to get bigger, bulkier, and not as good at delivering blood to your heart. And it's just, you could end up just like having a heart attack. So that
Wow.
think of that in context of the science that's going on inside of the body when this happens. There's a lot more that happens where your body thinks that it's super infected and it's not. And so you get very ill very quickly with high grade fevers, feeling very tired. And we see that kids are having it now.
Wow. Wow. Well, and I want to make a plug. If you missed the very first webinar that we had with Dr. Ofir and Dr. Chatani, we spoke in detail about, you know, this whole scenario. So he shares a lot more in that webinar. You can view all of that, jacksonevents.org. So take some time to look back and watch that. It was very, very good. Also, in terms of like, to help maybe prevent getting COVID, are there any like multivitamins or over-the-counter or natural remedy things you would encourage families to do to maybe prevent?
There's been some study about vitamin C and vitamin E and having appropriate levels. It's not 100%. I can't say that, you know, that any of the vitamins are going to 100% protect you from having COVID, or even in the necessary situation, prevent it from having as severe of an infection as it can be. But having a deficit in those can make it worse. So having a good level will definitely not necessarily hurt.
Okay.
There's
Awesome.
still so much that we don't know about this virus, but there are things that we do know. So again, to be able to protect ourselves, we wear a mask, we social distance, and we wash our hands.
That's right. WWW. I'm leaving with that. I'm going to for sure remember that. I need acronyms in my life. That's good. All right, let's do a blitz round because we just got like 9 minutes until the end of our time, but a blitz round about vaccines. Okay, so if children aren't going back to school, they're just doing virtually, do they need vaccines? Do they need to be updated?
The answer is absolutely yes. Absolutely. This is absolutely not the time to have an outbreak in measles or pertussis. Vaccines protect our children from very serious childhood diseases, and it is extremely important. Unfortunately, we know that in Florida right now, due to the pandemic, the rate of immunization is down. So this is the time to make that appointment with your pediatrician and make sure that your child is up to date, because the simple of it is vaccines save lives. So please do it.
Thank you. Thank you for that. What items should be on our back to school health checklist?
So aside from the vaccination, unfortunately, because of the pandemic, we know that also children have missed their well child care visit. So aside from checking whether they have received all of their vaccines, it is important to check with the pediatrician whether our children are up to date on their development and their milestone. Are they doing with that. Is their growth okay? So that's important to be able to come in and check on that as well. And then, of course, it is fair to ask what are the modifications that the office is taking, for the COVID. I think that some parents, I just want to put a little part in there, because some parents have not been coming in because they're scared. But
Right.
all pediatricians across the country, not even the state, have been really, really going above and beyond to make sure that their patients are safe when they're coming in. So please make sure to schedule that appointment.
Yes, that's so good. I have to say, I've been guilty. I've been that helicopter hover mom in the past, pre-pandemic, of like, I think my kid is sick, but I don't even know if it's worth going to the pediatrician and exposing them to something else, But at the end of the day, it's like you maybe should reevaluate your pediatrician choice if you're nervous about their situation of taking care, especially in these times, because like you said, everyone is going above and beyond to, your doctor's office is a healthy place for your child to be seen. So that's good. What about if children are not doing sports? Do they still need a physical if they're not going to be, they're doing band this year because they can't play football, right? So do they need a physical?
Well, yeah, I have had some patients who come in to be able to get their sports clearance form, because they need to be able to put the paperwork through to be able to be enrolled in that program for whenever the school is going to be able to reopen. I have for example, some college students who have their sports scholarship, and they need to be able to have that clearance in order to get the scholarship. So yes, absolutely. Even though they might not be able to participate right away in that sports, it is important for them to be able to get that form completed. So yes, get that appointment going with the pediatrician for that too.
Okay, great. What about if we've never given our child a flu vaccine before? Is this the year to do it? And does a flu vaccine protect them more against COVID?
So I'm going to take the first part of the question.
Okay.
More than never. Now more than never, and not just children. Please vaccinate against the flu this year. It is absolutely so very important this year to be able to be protected against the flu. Because first of all, just as Dr. Chatani mentioned earlier, because the symptoms are really very similar, but also because we don't really know what's going to be happening to an individual who gets both infections at the same time, COVID and influenza.
Oh, yeah.
Think about that.
Wow.
Go ahead and leave the floor to Dr. Chatani for the other part of the question.
And now's the time to get the vaccine, right? Like I always kind of think, oh, November, the colder months is like flu season, but when does it start? When's a good time?
Flu vaccine is available. Go get it.
Okay.
Now's the time.
End
Now's
of
the time. You want
September, we'll be getting it correct.
Okay.
Yeah. Now's the time, because you want to get the vaccine so you can have the available response in your body and have protection online before the virus has hit the community. So we might see, yes, we're predicting that numbers are going to be low, but that might just be the beginning, and then flu makes a hit later in the season.
Okay.
Florida, unfortunately, the viruses, especially those that infect like the nose and the lungs, they kind of they lag, they go for longer, and they can be, some of them are all season long. It's not just about the September through February month.
It's the Sunshine State thing again. I think it's like everybody wants to be here.
Everybody, including the viruses, they just want to be here all the time. So in pertaining to the other question, no, the flu vaccine will not necessarily protect you against COVID. But what a very good point that I want to emphasize that Dr. Ofir made is we don't know what happens if you get both.
Right.
COVID's bad enough by itself.
Right.
I can't imagine a child that gets both.
Yeah. Yeah, that is a thought. I hadn't had it all yet because I just can't take on flu yet. But here we are. We got to start thinking about it. Oh, okay. This is good. This is good. All right, we're almost done. So help us wrap up here with what's the status of a vaccine for COVID-19?
Yeah, it's actually pretty remarkable in how science has progressed. There are over 186 vaccine products that are currently in the first phase of being tested. Now, that's a long way from being commercially available so that you can go to your pediatrician's office and get it. There are 8 products that are currently in phase 3, the final phase of testing before they'll be commercially available. So we will see them. One company to pay attention to will be Moderna, because they've released the most amount of information. That being said, all of the studies are in adults. It's not likely very soon that we're going to see a vaccine available for children. But if it proves effective in adults, and so far it has, then we can protect our children by having an adult bubble of protection. If every adult around a child is vaccinated, then they can protect the same way that they protect them against the flu. They protect themselves and therefore protect from transmitting it to their child. So we'll be watching closely. These vaccines will not be without side effects. But we are looking closely to see what side effects those necessarily will be, and which product will be the best one to really promote.
Okay, this is good. I'm getting a lot more information from the pediatric infectious disease professor and doctor than I do on Instagram and the news. I'm just saying, let's go to the reliable sources. Thank you for sharing that. And just kind of a side note question I just have personally, but would they do a trial in children before it's like approved for children, I guess you would say?
Yes.
Okay.
There will be required that a trial in children occurs first, and that we are able to establish the safety and efficacy of the vaccine prior to its use.
Okay. I admit I'm a little skeptical. Is a vaccine like this safe to get once it comes out, or do I need 20 years of longitudinal research before I can do this?
It really depends on the research that is fully vetted before it comes out. So I would say that I can speak to the FDA and that their process is very rigorous, and it has only become more rigorous as time has gone along. I reflect back to the RSV virus, so the respiratory syncytial virus was a virus 1980s. We tried to develop a vaccine and weren't that successful with it. And that's because the processes that were in place at the time weren't as good as they are now, where there's a requirement for how many patients you need enrolled in these studies and how many outcomes you're able to document. So I think that once we have established it and the scientists and the FDA have approved it, we'll have more confidence that it will be safe and efficacious to use.
Oh, that's great. That's great. Wow, thank you both so much for your time and expertise tonight. I think we have maybe a slide with some resources, so we'll have that up here on the screen. But before we close out our time and sign off, I want to share some exciting news. So Dr. Ofir and Dr. Chatani were here for our very first one, and now I think we're about 8 weeks or so later, but we're continuing. And so now that summer is over and we're into school, we're going to be rebranding this series, and it's going to be known as Parental Guidance. So help yourself remember, think about like a movie rating, PG. It's totally rated G, actually. This whole thing will be rated G, but Parental Guidance, it's going to come in the fall, and it's going to be just the sequel to the time we've had together. So these family-friendly seminars are going to continue. We're going to bring you health experts, expert parents, and this is, our goal and our mission in this whole thing is to help produce, families who are healthy, not only physically, but just raising our kids well and with knowledge and being nurturing. So some upcoming topics, mark your calendars, because we've got some great topics coming up, including nutrition in kids, which will be our next webinar. So go ahead, save the date for September 3rd. That's a Thursday night, again, 8 p.m. But we're going to be talking about nutrition for kids and illustrating to parents how we can make healthy choices and also delicious meals that don't have to be difficult. And we're also going to get a demonstration